COVID-19, it's disrupted DePaul in many different ways. But now, after 4 quarters of remote learning, students are finally going back to the classroom. Yet many questions remain. Good Day DePaul's Theodora Kolavaris has details.
For the first time in over a year, DePaul students returned to the classroom for in-person learning. But with the start of the new academic year in the midst of a continuing global pandemic, students are seeing a few changes around campus. Hand sanitizer stations and plexiglass shields have been set up across buildings on both campuses, along with air filtration systems to improve ventilation. And according to DePaul's public health measures page, per the CDC's guidance, the university has turned off water fountain stations.
We're still encouraging people to wash their hands frequently and thoroughly. We're also suggesting people maintain distance as much as possible. And a lot of things that normally would have been in person, I mean, these aren't rules, but a lot of meetings and things that would have been in person, we're encouraging people to do outside or online.
Not only should students continue to socially distance, but everyone must continue to wear a mask indoors. According to DePaul's frequently asked questions page, any student who does not follow the university's mask mandate in the classroom or anywhere else on campus will be reminded to put one on. If they refuse, they will be asked to leave. Faculty members can also file an informational report with the Dean of Students' office if a student continues to refuse to wear a mask in the classroom. If the student refuses to leave the classroom for not wearing a mask, faculty can ask public safety for help. But the university says this should be used as a, quote, last resort. Forgot to bring a mask? DePaul has disposable masks available in lobbies on both campuses available for anyone to take. Scott Paith, a professor of religious studies and a member of DePaul's faculty council, says the university made the right decision to require masks on campus.
I think the university made the right call in advance of the city and the state making these decisions to go to a mask requirement until we can bring the COVID numbers back down to a reasonable level, until we've dealt with the Delta variant.
In addition to DePaul's mask mandate, the university is requiring all students, faculty, and staff to get vaccinated. As of September 15th, the university reports that more than 21,000 students and 2,600 faculty members have submitted their COVID-19 vaccine documentation. Some students can receive an exemption for medical or religious reasons, but not many have. About 2.6% or less than 500 students received an exemption. As a result, the university says these students must adhere to mandatory COVID-19 testing on a regular basis. Russell Dorn, the manager of news and integrated content at University Marketing and Communications, told Good Day DePaul in an email that, quote, the university is continuing to collect vaccine documentation and we expect the numbers of vaccinated faculty, staff, and students to continue to grow. But despite DePaul's high vaccination numbers, COVID-19 cases continue to rise at the university. As of September 21st, DePaul reported a total of 59 confirmed COVID-19 cases since the week ending on August 6th. But Craig Klugman, a professor of bioethics and health humanities at DePaul, says that the rise in cases doesn't mean that students, faculty, and staff are catching COVID-19 on campus.
Because so much of our faculty don't live on campus, our staff don't live on campus, most of our students don't live on campus. So is it community acquisition and they happen to be coming to DePaul when they're found to be positive? Or is it actually spreading within DePaul?
But the rise in cases has some faculty concerned about COVID-19 spreading in the classroom.
I'm teaching 2 full class sections, and I think from a social distancing perspective, I think I'd be more comfortable if there were fewer students in the class. And then the only other thing that I wish they had done differently is that I wish that they had given us the option, when numbers started to go up again, to switch classes that were scheduled to be in person to being online.
To monitor the spread of COVID-19 in the classroom, Dorn says the university is asking teachers to create a seating chart, adding that, quote, a seating chart would make contact tracing in a classroom much easier. At the same time, it's understood that this may not work for every course or every class meeting depending on what is planned for that class period. If a student does test positive, Dorn says they should report to DePaul's COVID-19 self-reporting website. And if it's someone in your class, Klugman says that people sitting within 6 feet of that person would be contacted, but that the whole class wouldn't need to get tested.
If you're close contact, right, 6 feet or less, we're going to want to contact this person, see how they're feeling, recommend they get tested. But the person, I'm running out of things, the person who is over here, sitting in the other side of the room, gotta keep it on my screen, who was maybe 20 feet away, would not have been exposed because they were far enough away. So you're not going to They don't have to get a test. They don't have to isolate or quarantine or anything like that.
And since students must wear a mask and be vaccinated to take in-person classes, Klugman says the chances of COVID-19 spreading in a classroom are very low.
The data says that we're probably not going to spread this in the classroom. If we sit, as close to every other seat as we can, spread out, use the whole room, if we're wearing our masks, if we're keeping our hands clean, we should be okay, theoretically. So there is the science. The reality is it's probably low likelihood in a room full of mostly vaccinated people.
If you're exposed to COVID-19 outside of the classroom, Dorn says students need to get tested, but the protocol is different for vaccinated and unvaccinated individuals. He says, quote, if vaccinated, get tested 3 to 5 days following exposure. There is no need to quarantine or report unless you test positive. If unvaccinated, quarantine immediately. Stay home except to get tested and do not attend in-person class. Follow Centers for Disease Control and Prevention guidelines and stay home for 10 days without testing or 7 days after receiving a negative test result. Test must occur on day 5 after exposure or later. And if you're feeling sick, Klugman says stay home and get tested.
Don't come to campus if you're sick or you have a positive test. And if you do have flu-like or cold-like symptoms, go get a test.
The university has set up testing facilities on both campuses. On the Lincoln Park campus, students can visit the lobby of the McGrath-Phillips Arena inside Sullivan Athletic Center, and in the Loop, testing is done in the concourse area at the DePaul Center. While the university hasn't announced plans for the rest of the year, DePaul says it will continue to monitor COVID-19 cases and follow the guidance of the Chicago Department of Public Health. For Good Day DePaul, I'm Theodora Coulivaris.